Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. A discussion that comes across my feed many times during the year is usually around the topic of one thing I wish my oncologist would have told me. There's actually a lot of things that people wish their oncologist would have told them back in the beginning of their cancer diagnosis. Now, of course, with me being a 35-year cancer survivor, I started my journey 37 years ago. And that was back before we had computers, before we had social media. I was definitely on my own. So I was relying on my oncologist to tell me everything I needed to know to be prepared for my journey through cancer and my life after cancer. And looking back, there were a lot of things that I can still remember that I wish, he would have told me. It's an obvious thing, a cancer patient or somebody who just gets diagnosed with cancer wants to know about their chances of cure and remission. And of course, wanting to know how it's going to be done, whether it's going to be through surgery, radiation, chemotherapy, immunotherapy, whatever. Those things are obviously important, and chances are they're almost always going to be discussed. But there are so many other things that cancer patients wish their oncologist would tell them. And not to come down totally hard on the oncologist, they have a difficult job. Of all medical fields, their job does not have the greatest success ratio because not everybody makes it. And I can only imagine what they must feel. I don't know that they recall all the success stories they have, but I'm pretty sure that they remember all the ones that are not. But cancer patients and survivors still, there are things that they wish oncologists would do to this day. And as difficult and as really critical we can be of our medical system, we still have some good doctors out there that are going to be willing to listen to you, to listen to the things that you ask for. And of course, there are those that are just looking at what they're being ordered to do. Just do your job, treat them, and send them on their way. Cancer patients deserve more than that. One of the things that cancer patients wish their oncologist would do more of, more honesty. And not just honesty, but honesty with compassion. Okay? Treating your patients like a human being and not a case number. I know that's the way I definitely felt in the beginning with mine. My employer actually upgraded my health insurance that would allow me to seek treatment in an environment that was going to be more appropriate for my needs emotionally in dealing with my cancer. Another big thing is making sure that the oncologist doesn't give up on us. Sometimes treatments don't go smoothly. It's important that we know you're not going to bail on us. Okay? Big one that I covered in my book here. Don't make us feel like a burden when we ask questions. In my book, I mentioned that the day before I was to begin my chemotherapy, I walked in with a huge legal pad, 1.5 pages full of questions. And my oncologist told me, I don't have time to answer these questions. This is ridiculous. This is the treatment. This is what I want you to go through, and boom, that's it. I had legitimate questions, and mentally, it was important that they got answered before I started my treatments. And with that, I walked out. I refused to get treated. Fortunately, I had somebody else on my side, one of my advocates, a therapist who was able to talk some sense into me and actually work out that if I couldn't get what I needed emotionally from this oncologist, I could switch doctors. Didn't know that was possible. Now, my concern was, well, won't I have to start all over? Won't this doctor want their own records and stuff like that? She goes, no. What if we stayed in the same group? I said, but wouldn't that be weird? No. And it wasn't. So that's how I handled that. A really big one is the potential for late side effects. As a long-term survivor of 35 years, and I know survivors of cancer 40 and 50 years out, not one of us was told of potential, and I'm emphasizing that, potential late side effects. Because back when we were treated, they didn't know. They created new treatments and they threw them right at the patients. We were experiments, we know that. So there was no knowledge of what could happen in the long run if we lived longer than those 5 years we keep hearing about. But the fact of the matter is that many cancers have survivors that live decades longer. And some of those survivors, not all of them, develop these late side effects that need to be dealt with. Well, how do you find out about them? Okay, well, your oncologist is well aware of them, and when they release you because there's nothing to follow up for your cancer anymore, there is the need to follow up for the potential late side effects, and they need to give you all the information necessary of what to look out for to give to your primary care doctor. And then your primary care doctor simply does what they do best. They ordered a test annually or that's done annually, and if your result comes back baseline, everything's good, you may not have to be followed up again for 3 or 4 more years on that. But you got to keep up on it. You don't want it to get to a point like in my case, April 15th, I will be talking about this. I got a rude awakening as far as long-term cancer survivorship goes. And I got lucky. So one place that if you don't get it from your oncologist, you can find it here. The website is survivorshipguidelines.org. And this is created by the Children's Oncology Group. Don't pay attention to that Children's Oncology Group, because what happens is, as you go through, you're going to see here, as I'm scrolling, a really thorough table of contents. And in that table of contents, they go through the various treatments, radiation, different chemotherapies, and these chemotherapies are actual treatments that are used not just in children's cancers, but other cancers as well. For instance, adriamycin or doxorubicin. Many of you may recognize that. We call it the red devil. Okay? In Hodgkin's, it's one of the main drugs to treat it. I'm in remission 36 years because of that. But it's also used in breast cancer treatments. Okay? Your surveillance plan for exposure to adriamycin is in that survivorship guidelines, as well as more. It's about 300 pages, so you actually do need to read through it to see what's important for you to have your primary care doctor talk about. Another thing, assure us, the cancer patient, our cancer is not our fault. We didn't do anything to get cancer. That's really important that you hit that. And then the other thing is, make sure that you encourage us to seek out mental help. Okay? Cancer is traumatic, and we're going to carry that trauma with us the rest of our lives. And that's what you need to tell us. That's going to come with us the rest of our lives. Whether it's fear of relapsing, whether it's having to deal with any kind of late effects, whether it's in establishing new relationships. When do we tell someone that we had cancer? Repairing friendships that weren't able to handle. I'm about to run out of time. Like I said, there's so many more of these questions or things that oncologists should tell us. Until next time, this is Paul's Heart.